My mother was diagnosed with multiple myeloma 2 years ago at the age of 66. The cost of her care has been astronomical. However, my family has been fortunate that both she and my father had long careers at good companies that afforded them the opportunity to save for retirement, which is helping to pay for her care. Mr. Vice President, what is your plan to make health care affordable so Americans don't need to drain their savings when care is necessary?
First of all, in the middle of this pandemic, what's the president doing? He's in federal court, trying to do away with the Affordable Care Act. 100 million people with pre-existing conditions like your mom would not have to pay more for their insurance under now. But guess what happens if in fact, he wins? That's number one. Number two, what I would do is make sure that we reinstate the Affordable Care Act, number one, and add a public option to that Affordable Care Act so that nobody in the United States of America would go without being able to be covered for what they need. With regard to COVID, for example, I don't want to get my son died of cancer. He came home from Iraq, and I have to tell you, it really, really offended me when he volunteered to go there for a year, and he came home because of with stage 4 glioblastoma. And the president referred to guys like my son. He won the Bronze Star, the Conspicuous Service Medal, referred to them as losers. Losers. Talk about losers. My point is this. The idea that health care is debated as whether or not it's a right or a privilege. It's an absolute right. And so we have to make sure, particularly in the moment of COVID, that any costs relating to COVID are in fact free. The federal government guarantees be taken care of. One of the reasons why people aren't going in and getting tested is they're afraid of the bill they're going to receive. They're afraid of what's going to happen. And with your mom, it's a different, multiple myeloma is a difficult disease to care for. And that's why one of the things I've done, well, anyway, I'm going on too much about cancer. I apologize.